Hi, I'm Luann. Welcome to the Woman to Woman Show. And my guest this evening is Dr. Grant Clark. Welcome to the show.
Thank you.
We have spoken on the phone about some of details that you want to share that very few people are brave enough to talk about. And I want to thank you for that because the world doesn't get to hear the truth about the abortion and the abortion industry and what an insider's view is like. And you offered to do that for us. And first of all, I want to say formerly had an experience with this. Could you just talk a little bit about how do you know about what abortion is really like?
Because of firsthand experience. Back in 1970, which is way before Roe versus Wade, it was legal to do abortions in California. And that's where I was practicing medicine in Northern California. And I swallowed the information that came from a conference in San Francisco at the University of California.
I'm so surprised.
I'm not. That said, this is not a good thing, but it's probably better than what's going on right now. And so I
Meaning
said,
what?
Meaning illegal abortions, meaning back behind the door abortions, meaning crazy things that people do to themselves.
So that's how they kind of justified it to you.
It's better to learn the techniques, do it right, save lives of the mother that way.
And you were in medical school when they said this?
No, I was in practice.
You were already in practice?
Yeah, I'd been in practice for 3 years before this happened.
And this was a county hospital?
In 5 years. But it was a county hospital in Northern California where I was practicing.
Okay. So these women would come in and say what?
They would say, Dr. Clark, I want an abortion. And then we would sit down and talk about alternatives. It was not a financial thing for me. In other words, I didn't get paid a penny more if I did them than if I didn't.
So that part wasn't in the picture like so many times it is today. But
my motivations were, can I help? Is this therapeutic? Is this going to help the patient? And at first I thought it was, and then it became more and more clear to me, no, it wasn't helping. It was doing a whole lot more harm than good.
You talked about when you were working during those days, thinking that, the circumstances were tragic that brought these women in seeking abortions. And you told me after a while, it didn't look that way anymore. Can you talk about that a little bit?
At first, everyone that I talked to, I tried to convince them that they should adopt out the child. And I had adopted a child myself that I had delivered. And so I was familiar with that route quite a bit. But more and more and more, it became, I must have it, I will have it, and if you don't do it, I'll go down to San Francisco and get it done. And they were not up to any alternative suggestions, and so they got done. But I did not like them from day one. It was not a fun procedure. It was not... with the baby's birth, everybody goes home happy. Yeah. Mother's delighted, the father's delighted. And if they're not delighted, they're really not delighted. And so it's an emotional high point, positive or negative. But with abortions, it was always sad. Mm-hmm. It was a sad situation. It's a sad outcome. And I don't think I obtained a single patient for future medical care from any of the abortions that I did.
So you didn't have a relationship with these women as their doctor before they... Because the pro-abortion people like to say, paint the picture that this is a close relationship, a woman and her doctor, and they're just, they trust each other. They've got this ongoing relationship. They're making this decision together because they know each other so well.
That sounds wonderful. Totally untrue.
Mm-hmm.
It's very professional, and I'm busy trying to talk people out of what they're trying to do. And so there's a conflict even from the start,
mm-hmm.
as far as my experience was concerned. Maybe with other doctors that their wonderful abortionist that they go to is in the inside really warm and fuzzy. I don't believe that at all. It's a sad situation.
Yeah.
It's a crisis situation, and you're trying to figure out ways of helping without hurting. And sometimes you win, sometimes you don't.
Where were you in your personal faith life when the actual years you were doing the abortions?
Interestingly enough, I was at a point in my life where I was beginning the most rapid growth in my faith life that has happened probably in my entire life. I was seeking the baptism of the Holy Spirit, and it did come, but this was a detriment to me, and it hurt, and it hurt me.
On the phone, you actually said the abortions themselves are grisly. You used that word. And I know it's hard to go back and relive it, but for the people out there that don't know, could you tell what you mean by that, because it's not talked about?
Well, most of the abortions that I did were in the first trimester of birth, the first 3 months, and it was done with a suction machine, a high-powered suction machine, vacuum cleaner. Dilate up the cervix and put in the tip of the suction machine and suction out the baby, which comes out in shreds. And after the procedure is over, you must make sure that you got all of the pieces of the baby. Otherwise, if you leave pieces in, it's likely to cause an infection. Although I've had several patients afterwards that said a week after the abortion, they were still passing little baby parts. So it is...
The women would actually see recognizable body parts.
Oh, yes. And not very much fun for them or for anyone else. That was probably the most difficult part of the whole abortion procedure with the suction abortions. Of you had to go through what you suctioned out of the uterus and identify perfectly formed little arms and legs and little hands, and skulls were usually crushed, but eyes and cute little noses, and you just killed a baby. And I don't care what you do, you can't bring them back. And so when the Lord actually showed me that this was not right in the least, I could not go back and bring back the lives of the children that I'd killed. That hurt, but I know that the Lord has forgiven me, and I keep on growing. I didn't know whether I should even mention this many years later, because that was in the 1970s, and so this is 25 plus years later. But I think at this point, what I have seen and witnessed should help someone, and that's my point.
I was just going to say, what made you call Oregon Right to Life?
I saw a billboard, and it said, "It's a score of abortion, 1 dead, 1 wounded." And I thought, no, 1 dead and a whole bunch of people wounded, including the doctor, the nurses involved, the anesthesiologist, the grandparents, the father of the baby, for Pete's sake. All of these people have been wounded, and a lot of times they don't know that they've been wounded. Sort of like having a broken ankle, and yet, well, it's maybe not broken and I'll get along with it. Well, that doesn't help it heal at all. So knowing that I have been wounded and knowing that I have wounded others, talking about it and bringing it out as something that is not good at all is useful. It's time to make a decision and say, this has to change. Our society can't go on this way of pretending that it's hunky-dory. It's not. It's murder.
Wow. You don't hear that very often. Certainly not in Portland, Oregon, and certainly not by the medical profession. And they need to hear it.
I had one other thing that was going on. You mentioned spiritual life. At the time while these abortions were going on, I was searching to try to find out the answer to age-old theological questions. When do I become me? When does any person stop being a, quote, blob of cells and become a person? And the scriptures that were impressed upon me, the first one would be coming from Luke, when John the Baptist leaped for joy when he heard Mary's voice. Yeah. Well, that could be poetic. It might be. But a couple of other verses that came to me later and in sequence, as a matter of fact, Jeremiah says, before I formed you, this is God speaking, before I formed you, I knew you. And I set you apart before your birth. And the question is, when before his birth was Jeremiah known by God as Jeremiah? Then there's Psalms, you knit me together in my mother's womb. You didn't knit together a bunch of cells, you knit me together in my mother's womb. Well, when did I enter my mother's womb? About 4 weeks of gestation. That's before the mother even knew she was pregnant.
The Bible makes it pretty clear, doesn't it?
It's confirmed even further in Job, where it says, your hand shaped me. You knit me together with bones and sinews. When are the bones formed? About 3 weeks of gestation, they start being formed. By 4 weeks, when the baby implants in the mother's womb, conception takes place out in the fallopian tube, but being in the mother's womb takes place at about the 4th week. So by the time that the mother even knows she is pregnant, you got a little baby in there with a complete skeleton as far as a backbone is concerned. Those are bones. I mean, that's what it talks about. You knit me together with bones and sinews. And also, got a heartbeat. My blood was circulating before my mother knew that I was alive.
Abortion stops a beating heart, and we're going to stop right there. And I want to talk to you about the good news that you also have in your story about adoption. We'll be right back.